free help. Real results, changing local families for the better.
Welcome to Health IQ Podcast. I'm your host, Brenda Bishop. Today, we are excited to share a resource that we have in our community that many of us were not aware of. Today, I have Rani, Eggert, and Michelle Erwin, and they're with Mesa Family Services. And I was just amazed at all the services that you all offer when you presented at our health council meeting last month. So I'm so happy you were able to join us. So I think we'll just dive right in. And we do want to say that your services are not just for Quay County. So if you're not from Quay County, these services go for, 5 counties?
4 counties.
Four counties. So you want to say which ones they are?
Sure. So Mesa Family Services serves Quay, Baca, Harding, and Guadalupe counties.
Right.
So Santa Rosa, Fort Sumner, Roy, as well as Tucumcari area.
And all of our other communities. So, and that's great for our region because many of those places are even smaller than us and have fewer resources. So let's just dive right in and talk about what the services are.
Okay. So Mesa Family Services, it's voluntary support for families with kids. We serve families that have kids from the age of weeks old all the way up till the age of 18. So it covers a broad spectrum of families and stuff. We help families come together to identify their strengths and what are some areas that they would really want some improvement on, and kind of try to help them discover some of those areas where they could get some extra help. A lot of what we do is parenting education and guidance. Kids, as it turns out, still do not come with instruction books. And so that is something that we even remark in the office quite a bit about, the fact that oh man, I would have used this for my own kids, or I'm going to suggest to my kid for my grandkids, that this might be a better direction to go. So we provide that parenting support, as well as getting them connected to resources in their community, making sure that their medical stuff gets caught up, and just overall trying to support a family to make them a better family together.
And so, you said families, but it's not, they don't have to be qualified. They can be any family,
right?
Correct?
So it doesn't have to be the traditional family of mom and dad and their kiddos and stuff. It can be, of course, single parents, also foster parents. We really kind of see a need of that for some of our foster parents as well, to be able to have some of that to help them with the kids that they're fostering at the time. Grandparents raising kids, pretty much if they're in the household, we are going to draw them in to find out how to be a better family together, however that family looks.
So the other day you were telling us about the parenting program. So, and that's what your job is, Rani, is the parenting program. So you want to give us a little outline of that program and how you present it?
So with my position, what I do is I work with the families in the home, which is their comfort zone. And so with working with them in the home, I'm able to help them provide those tools and skills that they'll need long term, since we're not in the home for that for that long. And so we just want to go ahead and give them a foundation. And so I work with them as far as learning new parenting techniques. Also, that could be positive discipline or organization, developing a chore chart, home. I don't know if I mentioned home organization, which could be putting the families to work together in the home. Also, if they need to learn different ways how to budget their monies, how to grocery shop. Also, what kind of services that they're lacking and that they're needing, whether if it's housing, helping them apply for housing if they need help with the application. Also, the consistency and structure of the home as well.
So you mentioned that you're going to their homes. And one of the things I thought was unique is you go at times when they're actually off work, right?
Yes. So I do work non-traditional hours. Those hours are for families who do work. And so I work, my job is not just from 8 to 5. It could be evenings. It could be weekends. And so, and also it helps them know they have that extra support in the home, which I meet with the family on a weekly basis.
And I remember you saying that there was a time limit of how long someone could stay in your program.
Right. So the majority of our program goes from 3 to 6 months in length, depending on what the family needs. However, it is possible for us to request an extension of up to 3 more months if we're seeing progress, but perhaps it's not as quickly as we thought it would go. We do run into that quite a bit with the fact that the counties we serve are quite rural. So if we're trying to make sure that a family is getting caught up on, immunizations or something like that, then they might have that doctor's appointment that suddenly becomes out of that 6 month. And so then we can request an extension for a month or even up to 3 months after that, so that we're making sure that the family is trying to reach that goal, is making progress towards reaching that goal.
So immunizations, that's interesting. So the services that you're trying to make sure that they cover all aspects of health, not just the parenting part, but other things to make sure that they're healthy. Because you mentioned shopping and budgeting and making their money work, and even organizing your home, and probably what is a clean home.
Yes, exactly. And when I'm in the home as well, is I talk to the family and get to know them and see what the needs are. And I work with them with goals. And so they have up to 5 goals that a lot of them just do 1 or 2. Some of them do 5, depending on their needs. And so some of them could be, needing how to get Medicaid, housing, or, just general, how to do medical to make sure that their children are up to date with all of the medical needs as well.
Okay. And then the other component is the counseling component. And even though you're the program manager, you're also the counselor.
Yes.
Michelle.
So we do have a licensed clinical counselor on staff, and that's myself. And so we, I think a lot of times, if we have somebody who's already got a counselor and everything, one of the big things that Rani is so good about doing is just making sure that they are engaging with them and making sure that they are actually, attending those appointments or whatever, If they don't, though, there's a lot of times that Rani can tell that there's a need for some of that within the family. And so she'll say, we do have a counselor if you guys would like to use her, or we can refer out to other counselors as well if they don't want to use myself as a counselor. But sometimes one of the biggest draws of that is the fact that our services are 100% free of charge. And that does include the counseling aspect of it. And so what that means is if you have a family who has private insurance and stuff, then during the time that they are with Mesa Family Services, they don't have to pay those, co-pays and stuff that sometimes will deter them from actually seeking help. Okay. And so that makes it very nice to have.
Mm-hmm. So you mentioned the foster parents. So I assume you work a lot with CYFD, but not all your clients come from CYFD, correct?
That's correct, yeah. So we are what's called a CBPIR, which means Community-Based intervention, prevention, and reunification service. And so we do work with CYFD, in particular with any of our ones who are working to reunify the family, to get the children back into the home and stuff. We will get referrals from them on that. We can work with those families longer term as well. We can work with them for up to 12 months. And so we work to reunify the family and to make sure the parents are ready to go home. And a lot of what Rani does, what we call them TLR, which is time-limited reunification, but a lot of what Rani does with them is also helps them prepare for their visits and things like that. So we definitely use that part. However, thankfully, because it's community-based, we don't have to just receive referrals from CYFD. So area primary care providers, other counselors, schools. I was trying to think where else we've gotten them from. We've even had one from a church before. Mm-hmm. So really, if you see a need or a family in need and stuff, also the family themselves or one of the people in the family can come up and say, I need some extra help, and they can self-refer as well.
And I see you all at some of our local events, so doing outreach to try to get those people to realize that they can refer themselves or what you have to offer. That's why I was like, they do something because they're here.
Right. Yep. Yes.
So the other thing is that I don't think we've touched on, but I think you said that they don't have to have a certain income guideline to qualify.
Mm. So we are funded 100% by a grant. And it has both federal monies and state monies that go into it and stuff. And so what that means is we are able to provide these opportunities using evidence-based curriculum. So that takes some training and stuff. So we're able to do all of that, and we're able to do it free of charge because of being funded by the grant. And so it makes it where we have very few limitations on being able to be a part of the program. As long as you've got kiddos, we can get started.
Well, and then you should even say you could even start right before the baby is born.
Yes. So we have had a few with some prenatal babies fixing to be born and stuff like that. And so a lot of times we've even helped them kind of, let's say they're going from one kid in the home to now 2 kids in the home. So helping them adjust and be ready for a new kiddo coming into the home because it's a whole new ballgame, as we know.
Yes.
When you go from 1 to 2, it's like it's completely different. And so this helps them be able to be prepared for that and stuff. And so, yes, we do start with them prenatal, generally only about a month or so before the baby's born, because we don't want to run out of time with them before some of those major adjustments and milestones start happening.
Well, I remember that second child, and I was like, wow, this is so much harder. Yes. You just don't think about it, how your schedules have to change.
Yes.
Mm-hmm.
And let's see. Was there anything else that I forgot about your services that you want to make sure we talk about?
Quay?
I would say also some of the challenges with our communities that we do serve is transportation. Mm-hmm. Just like in larger cities, they have bus, they have, other transportation. And in rural areas that sometimes our families don't have that transportation. I also can provide that transportation as part of our parenting as well. I've also helped, like if they need to go to the grocery store or if they need to go pay their bills or, maybe they need to go to the doctor or go to their counseling services. So I provide those, the transportation as needed as well.
Oh, that's a wonderful service because, when the weather's too hot or too cold, it's not fun to walk to the grocery store.
And we try to problem solve during that 6-month time so that so that they know how to get transportation then beyond that time frame and stuff. And just recently, we actually were able to help a family get a stroller because they're already used to walking, but now walking with a kiddo, we know becomes a whole new situation. And so we were able to do that, and that was pretty.
Especially when they are just learning to walk and they want to walk, but you don't want them to run out in front of a car.
Still do not understand the physics behind smaller legs going faster than larger legs, but that is a reality. And so just to keep things safe, and it was really a safety thing.
So do you have like a success story family, or how do you know when a family is successful, I guess, in your program?
So I've been doing this since the start of it about 7 years ago, and that we do have several success stories. What's interesting is we have successes, and then a few years down the road, they might come into our program again. And, because life changes in a few years' time. And so they might come into our program again. And so it's very fascinating when we have them with a double success, right? And they've come out of that. But I feel like we do a kind of an exit survey that goes through and is like, okay, this is how things were before. This is how things are now. Do you say this better, worse, about the same? Like kind of like an optometrist, honestly. And every single one of them has said that those aspects in their life have truly improved. I think one of the biggest things that we try to work on with them is communication. And, but we teach them that just by how we communicate with them, but then also show them how to communicate with each other. And so I do remember we did have a family at one point that I think the only way they could communicate was by yelling at each other. And it was great because after a while, by the time services were starting to wrap up and stuff, like Rani wasn't losing her voice anymore to be heard and stuff. And so we have had several families where it has been absolutely wonderful to see how their lives have changed. And to us, another marker of the fact that it's been successful is that we don't hear from them again, or we see them at these community events and they come up and they give us a hug, and they're just so thankful for that. And so I think I love being a part of the community events, but that's one of my favorites is when they come up and they're like, oh man, I still have my chore chart or whatever. And so certainly as far as that goes, I feel like Rani has made them significantly more successful in their visits with their kids. We kind of, I've worked with children and youth for 26 years probably. And one of my things is like, no excuse, get rid of all their excuses. So if something doesn't work out right at the end of the day, there's no excuse for why it didn't. It just didn't work out. And she's done a really good job in helping families when they visit their children and stuff to make sure that they have everything they need to have a successful visit with their kids. And then the rest is up to them. So
I think part of being in our program as well, we do have a small funding for each of our families also to reach their goals as well. For instance, if they want to organize their home, we can provide things to help them to achieve that goal. Maybe it could be with trash cans or broom or mop. Also, I've assisted families how to meal prep as well, because a lot of them work or they're just so overwhelmed. And so I help them meal prep. And so I provide them with a chart, or I provide them. So there's different things that we do help with families to achieve those goals.
Oh, cool. So I guess the next thing that we need to make sure we tell everybody is how to get a hold of you. And you do have a coworker who wasn't able to be here today. I don't know if she's the one who answers the phone or when you answer the phone, but how you get a hold of you and how you refer yourself, if you want to refer yourself or what you need to do to refer somebody.
All right. So I would say that for me to get a hold of me directly, it's going to be my email address, which is Michelle with 2 L's, MICHELLE at Mesa C as in counseling, F as in family, S as in services.com. That's probably the easiest way to get in touch with me. And then Rani has a phone number also.
And my phone number is 575-741-6177.
Okay. And they can just do either or to get a hold of you and request to be one of your families.
Yeah. And that's really all it takes is, if a family's wanting to self-refer, they can send an email, even a text message, and just, say who they are. And then let us know, hey, I'm really interested in your program. Can I get some more information? And we'll kind of get that lined out. Rani is our go-to. She's our family support specialist, and she's our go-to. However, whether you get in touch with her or with myself and everything, we will get you the information that you need. We have a referral form that you'll fill out. And if you have other people that you think might benefit from these, talk to them, ask them if they would be interested in it, and then you can help refer them as well. It's completely community-based, and so if you think it's something that would work well for a family then talk to them, see if they're interested, reach out to us, and we will definitely reach back out to you and get some stuff set up.
Wonderful. So I was thinking we have a couple of home visiting programs. We have kids enrolled in Head Start and those kinds of things that do to have some parent support, but could they still enroll in your program?
Yes, they absolutely can still enroll in our program. We've worked with families who have IMERSH coming into the home, or the PMS home visiting and stuff that come in, or any of those daycares and stuff. At this point in time, we have not run across any situation where the parenting curriculum that we are using, which is called Nurturing Parenting, is being used by any other program. So we are not, we are supporting each other in those efforts when that comes up. We are bolstering each other and providing the family with even more of a net of services and all. And you've actually had a family where you've worked with IMERSH as well, correct?
Yes, I've worked with IMERSH, MECA, also MHR, which they have a wraparound services as well. So yes. Yeah. So and that's the more support that we can provide for the family, the better that they'll be successful.
Well, and some of those programs age out at 5, but you guys can go to 18.
That's correct.
So you could actually start when their program is over if that works better for the family. Right. So that's wonderful. Thank you. So we do have some gifts. So thank you all for coming today.
Oh, thank you.
So this is one of our Health IQ mugs.
Oh,
And
thank you. Yes. I love a good cup.
well, and there, those kind that hold ice forever.
Yes.
So thank you. We really appreciate you coming today. And then we would also like to thank our outstanding production team of Joyce Runyon and Bobby Hockaday. And thank you all for joining us today. And please come back for another one of our great episodes for services that will help your family.
Special thanks to our guests, Michelle Erwin and Rani Eggert from Mesa Family Services, and our host, Brenda Bishop, Quay County Health Council Coordinator.
Podcast crew, Director, Robert F. Hockaday. Producers, Robert F. Hockaday, Joyce Runyon. Camera Operator, Robert F. Hockaday. Second Assistant Operator, Joyce Runyon. Editor, Joyce Runyon. Music provided by David Morris. Funding for this podcast is provided by New Mexico Legislative Appropriation from Representative Jack Chatfield. Brought to you by Quay County Health Council. Follow us on YouTube, Facebook, and Instagram at Quay County Health. If you have content ideas, reach out to us at healthiqpodcast@gmail.com.
This podcast was created solely for educational and entertainment purposes. It is not intended as a substitute for advice from a healthcare or mental health professional.